Interphase Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, Dagger Law, and the Frank E. Smith Funeral Home.
Welcome to Fairfield Today at Fairhope Hospice. Hi, I'm Kim Shook, Community Education Coordinator here at Fairhope Hospice and Palliative Care, home of the Pickering House. And we have Kristen.
Hello,
Yeah.
I'm Kristen Glazier and Fairhope's CEO and President, and we're glad to have you view us today. We've got some very special guests with us.
We sure do. We have Laura Schick, Admissions Coordinator for Hospice, and Kelly Frank, Admissions Coordinator for our Palliative Care. So welcome.
Thank you.
We are so glad to have you here today. This is a huge part of what Fairhope is all about, is what you do. You are the first voice many times of what families hear. So I just wanted to take a second and let you guys tell our listeners and our viewers exactly who you are and how long you've been with us. And Laura, we're going to let you go first.
Yes, Laura.
I'm Laura. I've been here 10 years. I'm a nurse and I do the admissions coordinating for hospice.
What was your background? Where did you come from before that?
Home health.
Okay.
And I am Kelly Frank, and I am the palliative care coordinator, and I've been here for 15 years. And I started off as an aide on the floor at the Pickering House.
Wow. So you actually were here when Virginia Pickering was here, right?
Yes, correct.
Okay. How was that?
It was wonderful.
And you got to be here when we opened, right?
Yes.
Okay. What is your background then? You work also with Dr. Varney, one of our medical director?
Yes.
Okay. All right.
His practice.
Yeah, it's funny because Laura, when I first started back here this time with Fairhope, you and I were roommates. So
Yes, we were.
so Laura was in half the office and she was do the admissions, and then I was in the other half of the office and I was doing the social work thing. And I'm going to tell you, I learned a lot. I have a new appreciation for you guys and just what you do and how hard it is and what you have to coordinate. I don't think people really understand really what that looks like. So that's why we wanted to have them today to kind of explain that to us. And
Yes.
Kelly, you and I worked together at Land Fair. When I was at Land Fair, you would come in with Dr. Varney, and you were sort of, maybe he won't watch this, but you were sort of the one that kept the wheels going and got him where he needed to go.
Yes.
And so, I think it's just fitting that you guys are here and you help coordinate all of our hospice calls and our families that call in with needs. So I think it's kind of neat that you are with us and you're doing such a great job with what we need you to do.
And the experience you bring, and being here, as long as you've been here, it's just amazing, because that tells your passion for what you do here. So tell us your passion for being at Fairhope Hospice and working with the families.
I think with anyone can receive devastating news of a poor prognosis. So anybody that calls in, you kind of think, I could be that person calling in too.
Making a difference.
And I would want somebody to take care of me and my family and my friends. So it's
And
very
we've seen
important.
so many patients and families benefit from hospice services and palliative.
Do you guys feel like sometimes when you get that call, does that feel like a lot of pressure, like emotional pressure, because someone's calling you saying, I just got the word from this doctor and now I don't know what to do and I'm calling you because they said to call you, what do I do?
Sometimes, yes.
But I always let them know that we are here to help. We have a fantastic team. We coordinate, facilitate, get what they need. Not just for the patient, but also for their family.
For the family.
They're not alone.
I think that's one of the most important things for families to know. I think when we do a lot of trainings, like with volunteers and just staff and things, one of the first things that I tell them is just, it's so hard to know what to do. So if you make one phone call, we have one phone number, you call one number, and that gets that ball rolling. And it really does start with you guys. We've grown. I don't know, Laura, when you first started and when you guys started, was it just the two of you?
It was Laura.
Just Laura?
It
You
was
started
me.
this? Tell me a little bit how that's changed for you.
It's changed a lot. We've grown a lot.
In what ways, and now how is it different?
A lot more calls. Yeah.
A lot more staff. We've
A
added
lot
more
more
staff.
staff.
Okay.
A lot more family and patients.
Yeah. Do you think the needs are changed? Like when you talk to families on the phone, do you think their needs are different, like that's changing too?
You know, with our PALS program,
Mm-hmm.
that's always a positive, and what are we going to do afterwards? So we
Yeah,
have
our
that.
grief- our
Our
grief
grief
support.
is fantastic.
I think that people are understanding the philosophy of hospice care and wanting to experience that for their loved one, and knowing that we can bring comfort as a team to their family and their loved one.
There's a lot of wheels to arranging for someone to be on hospice. One thing that's important for our viewers to know is that they don't have to worry about all those pieces. I mean, that's why you guys are here. You know what that next step is. So can you just tell us a little bit about what that looks like? If someone calls, if I call you and say, my doctor told me to call you, I don't know what to do now. What kind of things do you do?
I start out, I gather as much information as I can from the person calling, their name, if it's the patient themselves, and date of birth, and ask them a little bit about what's going on.
Okay.
Get the doctor's name, and then let them know that we will contact the doctor and get some records, get an order, and get that ball rolling for them.
Once we hear from that doctor and they give us an order, which is a doctor's order that says, yes, you may go see this patient, yes, I think they're appropriate, what happens then?
Then we make contact back with the patient or family and set that time up to meet with them.
So we would send our admission nurses or one of our staff out to meet with the family, explain our philosophy, see if that's really what they want, and if they agree to just the philosophy of hospice, and then we can initiate our services.
Right. And they can also determine then whether they would benefit more from palliative or hospice services.
So let's talk a little bit about palliative.
Yeah.
So give them the tools that they need to make a decision, a good decision for what they're going through.
What their needs are, and the diagnosis has a lot to do with it too, and where they are in that diagnosis.
So for those of you watching, you know, of course, Fairhope Hospice and Palliative Care, there's really two programs, and the hospice program is the hospice program. You know, we take care of anybody with a life expectancy of 6 months or less, but the palliative program has been with us for a long time. But as we see that kind of evolving and changing, that really is for patients who have a chronic illness that we know will eventually take their lives, but right now they're still pursuing that aggressive treatment.
Right.
You know, they're still working, going about their lives, but we know that they need a little extra eye on them. So, you know, Kelly has recently in the past year come to the palliative department, where she kind of mans the admission piece of the palliative team, like Laura does that for the hospice part. So you two have to kind of work together, because let's say someone calls in and they say, I need hospice, and we meet with them and they'll think, you know, I'm just not quite ready for that. So then what happens with that?
Then she refers them over to me for
Okay.
palliative.
Okay.
I reach out to the family, explain palliative program, and set up a consult to meet with them, with our nurse practitioners.
Okay, can you talk a little bit about that, like what that looks like? So we have 4 nurse practitioners, and the program's nurse practitioner driven. So when they go out, they will kind of assess the
They
patient.
do a head-to-toe assessment. They develop a care plan, and based off of that assessment, they'll set up future appointments. It might be a month later, it could be every other month. Sometimes it's within a couple weeks. It just depends on what their findings are.
Okay,
And they collaborate with the physician that's out in the community.
okay. So someone on palliative, they can still keep their physician if they
Yes.
want. We're an extra visit, an extra set of eyes.
Right, and they could continue their home health agency, physical therapy, treatments, whatever that they're still
Okay.
wanting to pursue in their treatment.
And
Okay.
report back to the physician, so it's good for somebody that's missing appointments that we can have our nurse practitioner go out and check on
Yes.
them and report to the physician. That's a good comfort for the physician too, to have
It is.
their patient on palliative care.
And
Some of them, it's hard for them to get out, so it is good that our nurse practitioners can go see them in the home and collaborate with their physician to let them know what they're seeing.
Yeah, it sure is. Want to give us our information to call?
Yes, so if you have questions regarding our hospice and palliative care, just give us a call at 740-654-7077. Our website is fairhopehospice.org, and our toll-free number is 800-994-7077. So yes, just lots of good information today, and we will be right back.
The moment that you're told that you have cancer, so many things were going through my mind.
I had this pain that kind of doubled over, and FMC got me the help that I needed, so I ended up surviving.
Fairfield Medical Center has helped me get through what was the hardest 6 months of my life.
When I first came to Fairfield Medical Center, she was probably having an allergic reaction. They saved her life, and that's why she's here today.
Life is unpredictable. That's why estate planning is important. Estate planning provides you comfort and peace of mind knowing that you're taking care of your loved ones and ensuring your legacy lives on just as you envisioned. You lived a life that is beautifully and uniquely yours. You deserve an estate planning attorney who understands that and creates a plan as unique as you and in the best interest of your loved ones. You deserve the local, trusted, experienced attorneys at Dagger Law.
Fairfield Federal. When it comes to our customers and our community, we go above and beyond to help. Our people make the difference.
We were retiring from Tucson, Arizona, and we made a retirement trip out around Ohio, having decided that's where we wanted to be. And we came across this town called Lancaster, and we fell in love with the downtown area, where the fountain is, and the memorials, and the flags, and all this stuff. And I looked around and I said, there's our bank right there.
There's something to be said about a community bank in your hometown.
Right. If you live in the community, you should do business in the community as much as possible. So it makes sense to bank with the community bank where you live.
Fairfield Federal is the bank to be at. If you live in this town, or any town actually, you want to bank at a local home bank. And the employees are happy here, they're conversant, customer service is through the roof. There's nothing more you could ask for.
Personal or business banking, whatever you need, we take it seriously because we know you do. Stop by today at any of our 3 locations and see why the difference is clear. Fairfield Federal Savings and Loan specializes in banking that revolves around you.
Member FDIC, Equal Housing Lender.
The Frankie Smith Funeral Home and Crematory in Lancaster and the Johnson Smith Funeral Home in Baltimore have a long and wonderful history of serving our community. Feel free to give us a call at 740-653-0652. Stop in and see us at either of our 2 locations, 405 North Columbus Street in Lancaster and 207 South Main Street in Baltimore. Respect for tradition, regard for change.
Welcome to Fairfield Today at Fairhope Hospice. Hi, I'm Kim Shook, Community Education Coordinator here at Fairhope Hospice and Palliative Care. Welcome back.
Welcome, and I'm Kristen Glazier, Fairhope's President and CEO, and today we are joined by 2 wonderful employees that we have. They both have the name of admission coordinator, one for each of our programs, the hospice program and palliative program, and they're just really sharing with us today a lot of the things that they do and how important I think their role is here at hospice and palliative, because we talked about that. You guys often are the very first voice that someone hears. So the way that the things that you say, the information that you gather is just really crucial to getting them to that next step. So
Yes, so Laura Schick, our hospice admissions coordinator, and Kelly Frank, our palliative admissions coordinator. So just lots of good information. So tell us about what a typical diagnosis for hospice would, our hospice care be needed for.
We have several cancer diagnoses, COPD, heart disease, liver disease, renal disease, and
Parkinson's disease, Alzheimer's disease.
And there's different criteria that you use, that the physicians use, that the nurses use to kind of decide which diagnosis might be the most appropriate diagnosis. You know, and I think kind of when we talk about that, we talk about the diagnosis that is related to their life expectancy. So like the last segment we talked about, when someone signs on hospice, their life expectancy is 6 months or less if that disease follows its course. So as you guys see and we see that sometimes those diseases don't follow the course, you know. So what happens then if we have a patient who has a diagnosis of cancer and at 7 months or 9 months, they're still with us, they're still, we're still taking care of them. It's okay to keep them on service.
Yes.
We just have to watch for those small declines and kind of reassess that. So that's a really important piece to that. You guys see so many different diagnoses. Like, how do you know what to choose or what to look for?
A lot of it comes from the physician.
Okay.
That's either referring, or if we aren't sure, we collaborate with our medical directors. Usually it's right there.
Okay. So you're kind of a detective. You have to kind of look at everything that you found and say, okay, this looks like the diagnosis that we need to use for hospice services or palliative services.
And then we look at the certain criteria that goes with that.
Okay. Yeah, it is a little bit of detective work, isn't it? Sometimes you have to really look to find things.
Sometimes, yes.
Yeah. Because I think sometimes, sometimes we just see people that are just declining. You can't quite put your finger on it. There's a lot of little things going around. So in those cases, we bring that to our medical directors to kind of take a look at, and then they'll look and see what maybe pops out and what we should use for that diagnosis.
Yes, we do that.
And then you have the aging process, and then other things kick in that may enhance their diagnosis for their hospice care.
Supporting diagnosis.
So tell us about how much of the team we support them from our staffing.
From our
at the beginning process.
Our admission nurses, our
aides,
case managing nurses, our social workers,
chaplains,
and our grief support.
Sometimes when you get a call and you're listening to someone tell their story, does something jump out to you and say, oh wow, they're really going to need to speak with a grief support team?
Absolutely.
Yes. Yeah. Or maybe you're thinking, oh my gosh, I think they need a social worker. We have the diagnosis, we have the medical piece, but I think there's a lot of things there that a social worker could help with.
And we have a lot of that too, the asking for resources,
Okay.
and we refer that to our social workers.
You guys really are like the jack of all trades. You have to know a little bit about everything, don't you?
From equipment, we have to order equipment that they're going to need in a home.
So if someone needs a hospital bed, you can get that?
Yes.
Oxygen.
Okay.
Oxygen, bedside table.
And those are all pieces of equipment and items that, under the Medicare benefit for hospice that we pay for and we cover. So if there's equipment that they need, if there are medications that they need that, pertain to their terminal diagnosis, we pay for those. We could send a social worker, a chaplain, an aide, a nurse. They're not going to get charged for those individual visits. And I think sometimes people don't understand or don't. I think when you tell them that, do you ever get that? Now, explain that to me again. I'm not going to get a bill. It's a Medicare benefit, insurance benefit.
They're really surprised when they hear that.
I'm sure.
Yeah, all that extra care that they get. It's been proven that when people sign on hospice care, they tend to get better because they do get all that extra support from our staff.
Well, it turns into quality of care.
Yes.
They just feel maybe we've managed their symptoms. Maybe they've been going back and forth to the hospital, readmissions, and they're in pain. But sometimes when they sign on hospice, then we realize we're able to keep them comfortable, get them on a good regime of whatever that looks like. They get comfortable and they're with us longer because it's a quality of life is really improved.
And their appetite and managing their meds and getting them that special bed. They're sleeping better, so they're getting more rest.
Well, Kim, tell us what our viewers have to do if they need to have any questions about Fairhope or palliative care.
Yes, just give us a call at 740-654-7077. Our website is fairhopehospice.org, and our toll-free number is 800-994-7077. Easy process, just give us a call. I know it's a hard call for families, but once you make the call, you gals make it easier.
And that's the whole point. We're really the experts here on care and Fairhope care and that process. We don't expect the families to be, so when they make that phone call, it really should be taken out of their hands because then the whole team, you guys get it started, it trickles down, we get everything we need, and then we call them and say, here we are, we're ready, let's meet. And I think that's so important to just take that responsibility out of their hands, because I think sometimes that's probably hard to make that call again for some reason, if we didn't take care of all this, I wonder if people would call back, because I think that's very stressful and hard to manage.
And they just don't make that call. And
Mhm.
so at least if the physician has mentioned hospice care, you know that if that conversation is happening, there is a need for it, or they wouldn't be calling. And then to make that call, and it doesn't mean that the doctor is anyone's giving up on that person with that diagnosis. It just means with the progress of the diagnosis, and then with the extra help of our care and support, it just can make it more comfortable and a more help during a difficult time.
Yeah, better, more quality.
Yeah, quality.
And anybody can make that call.
Talk about that, will you?
Yes.
Anybody can make a referral, whether it be family, patient themselves, neighbor, physician.
So what happens then? If I call in and I say, you know what, I have a family member, I think they need hospice, but I don't know what to do, what happens?
I'm going to ask you, have you talked to your family member regarding
Okay.
hospice services? If you tell me yes, then I'm going to get a little bit of information, and I'm going to call the physician for an order.
Wow, that really does take the burden off of that person then. Okay. Okay. So one of the things I think about is oftentimes people call, at a time where they're kind of in a crisis. So if they're calling you saying so-and-so's declined, the doctor told us we need to call hospice, we need someone now. So how soon can we work this all out in hospice and then also in palliative care too?
For hospice, it's usually the same day. I sometimes make it happen within an hour. I can have somebody there.
Wow.
So
Do you get a sense for the urgency sometimes? Like if a family
I
calls,
do.
you can tell?
Yes.
Okay.
Yes.
And then on the flip side of that, if a family calls and say, I just want information today, can someone come out and talk to us, but I'm not ready to sign on, you can even just do that.
we can do an informational visit only.
yeah.
What about palliative? How does that flow for palliative, like the urgency if someone calls?
I can usually tell, sometimes I think people are not sure what route they want to go, but just from what they're telling me, so based on that conversation, I usually have a nurse practitioner go out fairly soon to see that
Okay.
patient and talk with them and their family.
Does the nurse, I know the answer, but I'm going to ask you. So the nurse practitioner, when they go out, there could be a chance that they say, you know what, I think maybe you're appropriate for hospice. Okay. That's probably important conversation for those nurse practitioners to have.
Yes.
Yeah, okay.
It's good to start with palliative because it's just that extra set of eyes, like we said, and then we're there in the wings as they decline.
Yeah.
So that the nurse practitioner being able to make that visit for palliative is crucial too.
So what if we have someone that calls in at 6 at night and they say, oh my gosh, I need something, I don't know what to do, this is a bad situation. I mean, so how do we direct them then? And we do have staff available 24/7. So what would be that process if someone called in so late like that?
It's still the same process. We would still reach out to a physician to get the order. A lot of physicians will have their, on call. If it's something that's needed immediate attention, we can always reach out to our medical directors for that order. But we always try the physician first.
And so there's always a chance then that admission could happen really quickly and even
Yes.
at night, in the middle of the night. Okay. Do you ever, sometimes I think people say, well, why would we do that if we just, if my loved one is not well at all and it looks like maybe they're passing soon, why in the world would I do this? Would I call and have a nurse come out and do all this? And the one thing I think that people forget is that we have such a great bereavement team. So,
we do.
For however long this process is taken and then they get to us and maybe they pass pretty quickly, what's important too is what happens after. We can help them. We're going to reach out to them. We're going to send cards. We're going to call them. We're going to do all those things. So I think that's an important piece that often we kind of forget about.
Well, and they may have missed that care that they could have gotten, because a lot of people don't sign on soon enough. And that's why I think hospice gets bad reviews sometimes, because they don't sign on soon enough, and the families, they say they wish they would have signed on sooner than later, sooner, because then they would have had the benefit of all that extra care.
Yeah.
But if they don't, they still get that support even if it's a short amount of time, they still get that support during that crucial time at the end of life.
Right.
And then, like you said, we follow the families 13 months after the loved one passes. So
You know, and for those of you watching, if you're in a group or a church or, you know, someplace where you're interested in kind of what we're talking about and you would ever like someone from our agency to come out and just give you some information about really when is the right time to call for hospice care, please call the same number, one number will do everything you need, and we're glad to come out and we really want to educate people. We really want to come into the community and help people understand what we do, when we do it, and really why we do it. So
and just call 740-654-7077 is the key number to call for questions or concerns about hospice care. And then where do we care for hospice patients?
We care for patients if they're in a facility, if they're at home, assisted living facilities, the Pickering House, and our inpatient unit at the hospitals.
I think people forget about the hospital. You know, we do have beds at the hospital that we can use for patients who have signed on to hospice. Maybe they're very fragile, maybe they're comfortable there, you know, maybe they're going to pass there, but we still can come in and provide hospice care at the hospital, and so I think that's really important. Can you talk a little bit about the counties that we serve?
Yes, and it's a great partnership we have with Fairfield Medical Center.
Absolutely,
Yes,
absolutely.
amazing. So yes, I do community education here at Fairhope, and so we cover all of Fairfield, which our name is Fairhope. So Fairfield, H-O for the Hope is for Hocking, and the P-E is for Perry County. So it's just great that we cover all those areas. We do Circleville, Pickaway County also a little bit there, and Lower Licking and Canal Winchester, Pickerington, and all the way to Athens. We have our other community educator, Laura Kennedy, and she covers the Hocking, Perry, and Athens area. So lots of coverage.
Our goal has always been that we service families and patients who are an hour from here, from the Pickering House, because we want to respond quickly and timely. We always have 2 nurses on call. And I can't tell you how many times these ladies have come to me and said, okay, Kristen, this person is right here on the border of that hour time. So anytime that we can reach out and really help a family, we want to be timely and we want to just take good care of them. So
don't want to overextend our staff and the patients and their families when they're in crisis. We want to be there to be able to help them, bring them comfort.
And if they're out of our service area and they do call, we will give them the tools that they need to reach out to another provider.
Absolutely.
Bottom line is they need the care that they need, and we want to make sure they get it.
Yes.
Yep.
And in the home, wherever they may be, we can care for them, wherever they call home. So our number again, if you're having questions about hospice and palliative care, just give us a call at 740-654-7077, and our website, fairhopehospice.org, and our toll-free number, 800-994-7077. And thank you for being on our program today.
Thank you.
Laura Schick, Kelly Frank.
Thank
So
you,
glad
guys.
to have you.
Thank you.
And remember, we celebrate
life.
Interphase Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, Dagger Law, and the Frank E. Smith Funeral Home.